Hi, my name is Tim Ria, host of Informed Health 2016 here in beautiful San Francisco at UCSF. Guest today is Sarah Jane Militello Italiano. Nice name.
Yes, thank you.
And, yeah, prego, molto bene. So we had a good time last year here, and you're a Samsung and a partnership here with UCSF doing some very cool things in digital health.
That's right. Yeah, we have an innovation lab here just across the street from the Mission Bay campus of UCSF.
And so can you give people some of your background and how you kind of came to be in and some information about the partnership here?
Sure. Yeah, I'm Director of Operations here at the lab, and I guess my background has been both on the information system side as well as the device side in health. And so when you sort of think about digital health these days and all these devices, it's really an interesting combination of the information systems and the apps along with the actual instruments that are taking the measurements like your phone or your wearable.
And so we just had the Consumer Electronics Show in Vegas, and it's the new year, and a lot of new technology is kind of surfacing right now. What is changing this year in terms of the platform that you guys are pulling together?
Well, I think the next probably phase of digital health goes from gadgets or devices that simply take measurements, right, to really the apps and the algorithms and what can now bring together perhaps solutions for people that really have clinical effectiveness. And I think really being able to keep people sort of using these devices and really the stickiness of them really comes from providing solutions that really, get outcomes that people want to see. And those aspects, I think, are playing much more importance in terms of what's coming into the market.
So you have a lab here, and that's for entrepreneurs and industry to come in and collaborate and create new opportunities. And how do you facilitate and help add booster rockets to this activity?
Well, I think we play a very important role here in the lab, which is we're sort of validating the human impact of digital health. So we're really taking these new sensors or apps or algorithms and testing them in a clinical setting. Here at UCSF, we have the ability to tap into a large patient base, very specific patient base that may be needed to test them. And we work with the companies to really help design a study that really can help shed light on perhaps the right cohort of people for whom a particular device or technology would be effective, structure the study, put it through the institutional review board, recruit the participants, and then actually run the clinical study and then publish out the results. I like to think the additional things we can do, though, are and then lend insight, because here we have some of the best researchers in the world here who have tremendous insight and can help startup companies and even investors who are thinking about investing in this technology really perhaps take a different look at what the technology can do, or maybe even make some changes to it.
Yeah, it seems like if you have that infrastructure plus brain trust, the money will come in, which is really needed in the health space when it's typically harder to get companies funded.
Yes. Yeah, I think that's true. I mean, there's been a huge amount of money coming into digital health, but I think as I indicated, I think a lot of the early acceptance of the technology was more the early phase of, wow, we got to wear it, we got to have it. Now I think we're looking for, and are the outcomes a result of this? And will people continue to use these things, wear these things, and really get the kinds of outcomes that you would hope?
What's in the lab? I'm curious to get a kind of a walkthrough, and what's the experience that people would do when they sign up and get involved?
Yeah, well, I guess you're right. People aren't walking around in white coats, and we don't have a lot of beakers and maybe the kinds of things people think about in a clinical lab. What we do have are bicycles and, the kinds of things that really help people perhaps under exercise conditions or in motion, really use these devices. As an example, if you're taking blood pressure or any kinds of things, there's a difference between taking it via the arm, sort of the traditional placement of a blood pressure cuff, and now newer devices that take blood pressure at the wrist. So, we need to be able to establish which are the most effective ways to do it and with what types of people in what types of situations to get accurate readings and readings that help people understand how to do things differently in their lives.
So what's happening on the informatics level? with all of this data, and how are you guys crunching stuff in the cloud, I guess, is what you guys are working on.
It is, and through the partnership, we do work with Samsung, who has a platform called SAMI that actually has a very easy interface, which is how it's designed from all kinds of devices and electronic health records to sort of dump data up to the cloud. And of course, there are many analytical tools now coming into the market to help you really crunch through that data. I think what's most interesting is it's not just biometric data now. It's really, if you take both the electronic health record, which would have the history of a lot of a person's condition, perhaps the addition of genetic data now and the ability to capture that. And then you start to look at the environment and things that can measure temperature or quality of air or other kinds of things in someone's environment. Once you put all of that truly rich data together, then you begin to really be able to sort of get a precise solution for someone in the healthcare space called precision medicine, really. Yeah. And that's what's really enabled today, and I think it's just advancing very, very quickly.
Well, that's super exciting. I mean, a lot of advances have changed from even just last year to this year. So if I'm an entrepreneur or a corporate partner or an investor, how do I get involved?
Well, you go to our website, for one thing, to see what we're doing. It's dhil.ucsf.edu. Okay. Follow us on Twitter. Come meet us at shows like this at Informed Health, and we'd love to work with some interesting partners.
Yeah, I met the teams here. You guys have just a fantastic, really open, really relaxed team, approachable, and you have a great support network.
Definitely, and a really interesting partnership between really leading medical center, really interesting consumer electronics company, and really makes for some interesting projects that we do.
Cool. Well, good to see you again. Thanks for being on the show.
Thanks a lot, Tim. Enjoyed it.